Hi, my name is Claire Conlon and I'm the National Manager of Advocacy, Research and Policy.
And hi, I'm Gerard Reed, Director of Business Development and Company Secretary. Thanks for joining us today at our brand new office in Frankston, Bayside, south of Melbourne. In this video today, we want to talk about our advocacy activities over the last 12 months and the important business of mental health reform in Victoria.
But first, I would like to acknowledge the traditional custodians of the land, which we are on today, here in Frankston, which is south of Melbourne. I'd like to acknowledge the Wurrung people, who are actually one of 30 tribes who are still occupying Victoria.
There's massive reforms happening in the Victoria mental health reform as a result of the Royal Commission. And it sees some things that Wellways has been advocating for years coming to fruition, including the centrality of the lived experience voice right through the service system. We've also for years been advocating for contemporary solutions in housing, employment, and ensuring that people have meaningful relationships in the community, living in places of their choice, working in jobs that they want to achieve their full potential. We'll continue to advocate for these things over the next 10 years of the implementation of mental health reform in Victoria, and hopefully then the rest of the country as well. Wellways is also fully committed to First Nations justice. Each of our regional teams and all teams across the organisation have action plans with courageous commitments to help us be the best allies we can to First Nations people. We want to be the best allies we can on their journey of recognition, truth-telling and treaty. Wellways is committed to working with the LGBTIQA+ community, the queer community, of which I'm a proud member. We continue to strengthen the ways in which we can work with this community who are overrepresented in mental health services because of stigma and discrimination in the community.
Wellways was founded on families who advocated in this space for people experiencing mental health are wanting to improve those experiences as well as their carers. And I really want to honour that legacy by working in this advocacy space. So there's a real solidarity and strength here at Wellways in working in partnerships and a real commitment to working with like-minded organisations in addressing those barriers that get in the way of people living their best lives so that they can achieve and imagine their goals and outcomes.
This year, Wellways proudly relaunched our annual Woodcock Lecture, both online and in person. During this well-received industry event, we explored what it meant for people with lived experience to be involved in governance at all levels of a reformed mental health system. The Royal Commission into Victoria's mental health services told us that mental health services need to be delivered better, that there was systemic failure. Wellways is working with local communities in Benalla and Wangaratta and Geelong and here in Frankston in this very building to deliver in partnership with clinical and alcohol and drug services the first mental health and wellbeing local services in Victoria, the first 3 of 60. These services will offer a range of therapies and wellbeing supports in a way that's never been done before.
And this is what advocacy and reform looks like in 2022. We'd really like to thank you so much for watching this short clip. And if you would like more information, please go to our new website at wellways.org.